I'm Caroline. I'm a trained doula with Birth Prep Doulas. And in this video, I'm going to be talking to you about when to call your doctor at any point during your pregnancy. And we're just going to go down the trimesters for signs to look for. So during the first trimester, if you experience low back pain that is constant and worsens over time, you need to let your doctor know immediately. If you have any bright red discharge or bleeding, that is something that your doctor needs to know right away. And if you have severe nausea or vomiting. Now, for the first two symptoms that I mentioned, the bleeding and the low back pain, the doctors want to make sure that you're not at risk for miscarriage. And then with the nausea and vomiting, it could be hyperemesis gravidarum, and that is treatable. And so you want to let your doctor know so that they can treat you so that you're able to take the nourishment in and hold it in that you need for your baby to develop well. And then let's get into the second trimester. Second trimester, if you feel any pelvic pressure with cramping, you are going to start feeling a little bit more pressure, but it should not be cramping during the second trimester. So you want to get checked out to make sure that nothing is happening that is happening too soon. And then if you have a sudden headache with blurry vision or with dizziness or with numbness or tingling on any part of your body, you definitely want to let your doctor know right away so they can check out for check your blood pressure or check you for gestational diabetes or any other causes for these symptoms. That is not normal. And then if you have difficulty breathing, you are going to feel like it's a little bit more of a challenge to breathe when you're pregnant because all your internal organs are pushed in all kinds of fascinating positions. But you should not have severe difficulty breathing. And especially if it comes with chest pain and with a cough, you want to let your doctor know immediately so that they can perform chest x-rays and rule out pneumonia or rule out a heart condition or anything else that it could be. And then during the third trimester, you're going to be feeling a lot more pressure in your pelvic area. And later on in the third trimester, there may be a little bit of cramping. However, if it's painful and it continues for more than 2 hours, or if it's coming every 5 minutes for over an hour and you're not yet at 37 weeks, you definitely want to have your doctor know so that they can determine if you're having preterm labor and do what they need to do to keep you and your baby safe. And then if you have any bleeding, you should not be having any bleeding at any time during your pregnancy. You may have some spotting or some discharge towards the end of your pregnancy that is maybe brownish, pinkish, but it should not be bright red. Let your doctor know if it's bright red. If your water breaks at any time, whether you are before term, before 37 weeks, or after term, your doctor needs to know right away because we pay a lot of attention to the time that your water breaks. And if you are preterm, then we want to find out what interventions need to happen right away so that we can make sure that everybody is safe and healthy. If you have not felt any fetal movement for over 12 hours, or if you notice that your baby is not moving as often as you felt them move, you want to mention it. There are ways to count the baby cakes, and that's a whole other topic. But if you're feeling concerned and you've talked to your doula and they've helped you count the fetal cakes and you're still feeling like you're concerned, you definitely want to let your doctor know so that they can perform an ultrasound and see what's going on with the baby. And then if you have whole body itching that does not get relieved with lotion or with taking a bath or with scratching it, and it doesn't have a rash, you want to let your doctor know because that could be a couple of things. And one of them is actually very, very dangerous, and it needs to be intervened immediately. And then at any point of your pregnancy, if you have a fever, you want to let your doctor know so that they can determine what it is going on that's causing you to have a fever, and they can give you a pregnancy safe intervention for whatever it is that you're dealing with. I hope that was helpful for you to know when to call your doctor. And when in doubt, run it by your doula, and they will let you know if you need to call your doctor if this is normal or not normal. And thank you for your time, and we'll talk some more next time. Bye bye.